ability to isolate.
Yeah.
But a lot of them don't, and so to force those people in is really problematic. So.
And see how they you have not had a single coronavirus case.
Coronavirus. No residents, no employees.
How often are the employees getting tested?
How often are they get screened before?
Go for fever and everything?
Yep, yep. In a questionnaire prior to the
Yeah, no, we instituted that in March. But you know, you do have some instances where they do follow it, but you have to make systematic spread, and so that's why we're sending the National Guard. Like we're doing all these, we have 50 strike teams, and then we have a mobile lab now that we take with the rapid test. But like this facility wouldn't be the top priority because you guys do such a good job. We're trying to go to the ones that have had problems with infection control.
Right.
Because if you can document 1 or 2 cases but isolate it, you can prevent a major outbreak. So we're really working kind of in an expeditionary way to do that.
Also, most nursing homes have semi-private rooms where they share.
Yeah.
All our rooms are essentially private.
Oh, that's good.
So we're able to self-quarantine residents.
Do you have negative pressure rooms?
No, we don't have negative pressure.
Really proud of you. Will you give the whole team, I'm going to wave now, will you give the whole team a very best?
We'll do.
You give our love to all the residents. I'm obviously blessed to be with you.
We're very excited to have you here. We're really honored.
Well, I don't know if anybody can see it, but some people up there. Well, listen, thank you so much. Hope this helps a little bit. We'll keep the help coming, Governor.
Yeah.
Okay?
Thank you.
Whatever you need. Just keep up the great work. Did we take a picture, Miles? Did you get a good picture?
Negative test number 4.
Slide over here, Governor. We'll take one good picture.
Right here, please. So when you have an outbreak, you have a place to transfer people without having to take
Hi everybody, I'm Vice President Mike Pence. I am here with the great Governor Ron DeSantis and the head of as I told families and I told Shirley, we are incredibly proud of Westminster, the Mall, the district, the great team providing the great service to our residents. Each and every one of them. Their job well done. Really set the pace here. Early on in this pandemic, we've known, as you know, the team of the city were one of the most vulnerable, and here at Westminster Ballroom Park, we have worked over the greatest year. Everyone that resides here, I see a few up in the windows. I hope you will give them all our best for the fun that we come back here. And thank you all for thank you all. God bless you. Keep up the great work. Okay? And here's the governor. I just want to say thank you. You guys really stepped up. Protected the most vulnerable we knew. These are the types of facilities that have gone through all this for several months now without having a single case. This shows a tremendous job that people did here to save lives and to be tremendous at that. So God bless everyone today.
Well, thanks everybody. Good to be here with Governor DeSantis, Westminster. Baldwin Park is really an extraordinary facility, not a single coronavirus case in this facility. That's a testament to these extraordinary healthcare workers that we just had an opportunity to address. I want to thank Shirley and family for the great work that you've done here. Early on in this pandemic, we recognized at the White House Coronavirus Task Force that seniors with serious underlying health conditions were most at risk for heartbreaking outcomes to this virus. And early on, it would be March 4th, that Seema Verma at the Center for Medicaid and Medicare Services at the President's direction actually ordered all of the infectious disease standards at nursing homes around the country to be raised to the highest level. We also deployed all 8,000 of our inspectors across the country to focus exclusively on making sure that our nursing homes were living up to those new standards to protect the most vulnerable. And we are going to continue to make sure that people that are caring for the most vulnerable today, tomorrow, and every day in the future have the resources and the support that they need. Governor, the boxes that we arrived with today were brought here on Air Force Two, but they're just simply part of the delivery of similar personal protective equipment that's going as we speak to 15,400 nursing homes across the country. And Governor, our pledge to you is we're going to continue to make sure that your healthcare workers, including those who serve in nursing homes and long-term healthcare facilities, have the resources to protect themselves while they're protecting the most vulnerable. But let me just say again to Shirley and to family and the whole team here, thank you for the extraordinary work that you've done. You really have set the highest standard here at Westminster Baldwin Park. I know the people of Florida are proud and grateful, but on behalf of your president and on behalf of people all across this country, thank you for caring, thank you for loving these people, and thank you for the standards that you've lived out here. And with that, it's a pleasure to be here with Governor Ron DeSantis. Governor DeSantis from early on made a priority of seniors here in Florida. Your administration recognized the unique challenges that seniors, particularly those with underlying health conditions, would have with the coronavirus. I know while we were raising standards at the national level, you were implementing limitations on people entering nursing homes. You created new standards, you enforced those. And let me just say, Governor, we're really grateful for your leadership. And now, as Florida begins to open up again in counties across the state, following your best information, your best analysis, we're going to continue to partner with you to protect our most vulnerable, but to get Florida and America back to work. So thank you, Governor. It's great to be here with you, and thanks for your leadership.
Well, thanks, Mr. Vice President, for coming. Appreciate this. We've really viewed, if you look at the statistics worldwide now, probably 50% or more fatalities from this are coming in long-term care facilities. So we saw that data early, and we did do things like, and they've done it religiously, require everyone, all staff, to be screened every day. Temperature check, ask questions to make sure they're not bringing it in. We also prohibited COVID positive patients from being sent back to these facilities. Obviously, some states forced that. I think that was a really bad thing, so we were able to do that here. We also started sending a lot of PPE, and this is very important. And the thought was, here we are sending all this to hospitals, which is important, but if you can give the PPE to really the front lines, these facilities, you will have fewer hospitalizations if they're able to do that. So we've now in Florida sent more than 10 million masks, more than 1 million gloves, and more than 500,000 face shields just to long-term care facilities in the state of Florida. We had, in this facility here, has not had a single infection. We have over 4,000 facilities in the state of Florida, and I think at least 3,500 of them have not seen one single case. That is really phenomenal for them to do. What we did start seeing was some asymptomatic staff come in. So no fever,
would pass the questions, and then you'd end up seeing it spread usually amongst the staff first. So we did, so I created 50 National Guard strike teams. They partner with the Florida Department of Health, and they go to the facilities, usually the ones that are the most risky in terms of their infection record. So you guys would probably be behind the list because you've done such a good job. So we send them there, they test, and then you're able to isolate anyone who's infected. We also did the first mobile lab. We created an RV with a Cepheid 45-minute rapid test. So that mobile lab goes around Florida. They go out, they get samples, they run them. You get the results in real time. I mean, some of the labs take 24, 48, 72 hours, which is, okay, you want the result. You get that result right there. You have a couple positives. You can isolate them appropriately. And so I think that that's something that's been very, very important for us with this testing. So we're going to continue doing that. And I can tell you in the state of Florida right now, today we reported a bunch of tests, like 75,000. I think there were 400 some positive, maybe 500. So it was 0.67% positivity rate. And if you look throughout, that's been pretty consistent. I can tell you in Florida, particularly outside Miami and West Palm and Broward, when you see cases crop up, it's usually related to a prison or a long-term care facility at this point. We're not seeing any kind of spikes from the general public. And even Miami and South Florida, you definitely see a decline from where they were. Miami reported 69 cases today. At their height, they were at 500 in early April. So that is really there, but this is a discrete issue that requires certain focus. We've done that from the beginning, but I've told my folks and all the agencies, this is going to continue to be the tip of the spear. So as we do things to get people back to work, we're not going to stop doing this. In fact, we'll probably be doing even more, and I think that'll make a big difference.
That's right. Thank you, Governor. And I really think Florida has set the pace. I mean, you have a large senior population here, and the way you've deployed testing, the way you implemented and echoed and federal guidance is commendable. And let me also say, as I recognize Seema Verma, who leads the Center for Medicaid and Medicare Services and has done a phenomenal job seeing to the protection, particularly of seniors around America. Let me also just say thank you to our seniors. I was back in Indiana not long ago and wasn't able to go see my mom. I mean, it's been hard for people to forego seeing their moms, their dads, their grandmother, their grandfather, a loved one. But for the seniors, for family members who've been willing to adhere to the guidelines that have been issued at the federal and state level, we just want to say thank you. Thank you for being a part of the success that you've had here in Florida. We grieve for the loss of life here in Florida. We grieve for the loss of more than 90,000 Americans, and their families are in our prayers. But we know the steps that Americans have taken. We know the steps that people have taken to make sacrifices in the opportunity they have to be with family members, and the steps that seniors have taken have saved lives. And we admire you and are grateful for you every day. Seema, did you have a quick word?
Again, just want to say thank you to the staff here that's done a terrific job, and Governor DeSantis, your leadership has been amazing to see you implement the federal guidelines, and you've just shown leadership in terms of separating patients, isolation. All those techniques make a really big difference. And we know that this has been particularly hard on families being separated from their loved ones. Just this week, we've put out reopening guidelines for nursing homes that will help guide state and local efforts to reunite families with their loved ones. I think those procedures are calling for testing and screening, a lot of the things that Governor DeSantis has already done in the state. So we're looking forward to families being reunited with their loved ones, and we know that that's so important for quality of life. Thank you.
Thank you. Any quick questions here for the governor?
Some states are not being so transparent about the cases in their long-term care facilities and other operations. Does that concern you?
Well, from very early on, our administration has made a priority of protecting the most vulnerable, beginning with seniors with serious underlying health conditions, and having the best information about the conditions that people are facing has been absolutely essential to that. And what I can tell you, and Seema, you can respond to it, we've literally been working around the clock to get real-time information on hospitalizations and real-time information on compliance. As I mentioned, we have more than 8,000 inspectors around the country, and Florida's been a tremendous partner with us every step of the way, but we're going to continue to work with every state in the union, make sure we have that information so that we can, as the governor said, not just today, not just in this pandemic to this point, but going forward, we're going to continue to surge supplies and testing and do the kind of surveillance in our nursing homes and long-term care facilities that will prevent any outbreak among our most vulnerable. But Seema?
Well, I think President Trump has had a long-standing commitment to transparency, quality transparency, price transparency, and this is no different. We changed the regulations to require nursing homes to inform families and residents of the facilities if there's COVID virus in the nursing home. Very unprecedented. It's never been done before. And we're also requiring nursing homes to report information directly into the CDC. That information is just starting to be collected, and we will be making that public at the end of the month.
Great. Any other questions? Go ahead.
Vice President, on that issue of transparency, Florida recently dismissed a worker who was adding data to the state website about coronavirus cases. I'm wondering.
We should just have me take that. He doesn't know about it. So let me just first.
Can I ask my question first?
Okay.
I know that you've addressed this before, but there's a question of why the state asked her to remove data that had already
Right.
been put.
So first of all, okay. So one, she's not a data scientist. She's somebody that's got a degree in journalism, communication, and geography. She is not involved in collating any data. She does not have the expertise to do that. She is not an epidemiologist. She is not the chief architect of our web portal. That is another false statement. And what she was doing was she was putting data on the portal which the scientists didn't believe was valid data. So she didn't listen to the people who were her superiors. She had many people above her in the chain of command. And so she was dismissed because of that and because of a bunch of different reasons about how she did. Come to find out, she's also under active criminal charges in the state of Florida. She's being charged with cyber stalking and cyber sexual harassment. So I've asked the Department of Health to explain to me how someone would be allowed to be charged with that and continue on, because this was many months ago. I have a zero tolerance policy for sexual harassment. So her supervisor dismissed her because of a lot of those reasons, and it was a totally valid way, but she should have been dismissed long before that. Our data is available. Our data is transparent. In fact, Dr. Birx has talked multiple times about how Florida has the absolute best data. So any insinuation otherwise is just typical partisan narrative trying to be spun. And part of the reason is that because you got a lot of people in your profession who waxed poetically for weeks and weeks about how Florida was going to be just like New York. Wait 2 weeks, Florida's going to be next. Just like Italy, wait 2 weeks. Well, hell, we're 8 weeks away from that, and it hasn't happened. Not only do we have a lower death rate, well, we have way lower deaths generally. We have a lower death rate than the Acela Corridor, D.C., everyone up there. We have a lower death rate than the Midwest, Illinois, Michigan, Indiana, Ohio. But even in our region, Louisiana, Mississippi, Alabama, Georgia, Florida has the lower death rate, and I was the #1 landing spot from tens of thousands of people leaving the #1 hot zone in the world to come to my state. So we've succeeded, and I think that people just don't want to recognize it because it challenges their narrative, it challenges their assumption, so they got to try to find a boogeyman. Maybe it's that there are black helicopters circling the Department of Health. If you believe that, I got a bridge in Brooklyn I'd like to sell you.
Last question.
Are you considering banning flights from Brazil as infections rise
I
there?
can't do that, so that'd be a question for the VP.
We're watching very carefully what's taking place in South America, including in Brazil. We saw in recent days there was a significant spike in cases, and the President's made it clear that we're considering additional travel restrictions, not just including Brazil, but other countries. I mean, it's always important to say that before we had a single case of community transmission in the United States, President Trump suspended all travel from China in late January. It's at the same time he stood up the White House Coronavirus Task Force. It's undeniable, while that was harshly criticized by many partisans, it's undeniable that that bought us invaluable time to stand up a national response, to partner with states to be able to take the steps that we've taken that we know saved lives, to partner with states and, more importantly, to partner with the American people to slow the spread. We have flattened the curve. Florida's done a truly remarkable job here because the people of Florida stepped up. Your governor, your administration stepped up. You implemented the guidance, not just for nursing homes, but for every American. And but travel restrictions were a part of our strategy early on. The president would not only restrict travel from China, but screen all passengers from there, screen passengers ultimately from South Korea, Italy, and then suspend travel from Europe, the UK, and Ireland.
But when you guys did the China restrictions, there was this thing in the media saying, oh, well, 40,000 or 50,000 Americans came back after that. That's true, but they were all monitored, and the Hubei people were all self-isolated. So I had Floridians on the West Coast waiting for 14 days, testing, then they came back. The ones who were in other parts of China were allowed to come back to Florida, but CDC gave the information to our Department of Health, and they were monitored for 14 days. And some were ended up testing. Fortunately, most of them didn't come back positive, but that was something that was being done all across the country, even for the Americans. And obviously, we want the Americans to come back, but it's not like the floodgates just opened and people came. No. All those folks were being monitored. And the one thing I would also add just about kind of what we saw in Florida.
11 different airports were screening any Americans that were returning from the affected areas in China.
In Florida, if you go back and look, the hospitalizations in like the last week of February, we were probably about 88% full with all our beds. At the height of the pandemic, we were closer to 50% full. I think we were 55. We hover between 50 and 55%. So, we actually gained capacity during the pandemic. We're never threatened with hospitals being overrun. And today, we have the fewest numbers of COVID patients on ventilators that we've had since the month of March. So those trends are obviously good for us.
So
thanks very much.
Let me say thank you again to the great team here, to Shirley and all the wonderful nurses. I hope you will give them our thanks and our gratitude, and give all the residents here our love. And finally, just thank you for this outstanding team. The way you've responded to federal guidance, the state's guidance, has represented the highest level of care. And we want to commend you for that, thank you for that. And we'll keep the help coming, and we'll get through this. The truth is that as we see Florida and states around the country beginning to open up, all 50 states in America have now begun to partially open up. It's because of what the American people have done. It's because of our partnership with governors like Governor DeSantis, and it's because of the leadership that President Trump provided from early on. We have a ways to go, but we can see light at the end of the tunnel, and Governor, we thank you so much for your strong leadership here, particularly on behalf of our cherished seniors here in Florida. And to them, again, I want to say thank you. Thank you for the sacrifices that you have made and your families have made during this challenging time, and God bless you all.
Did the president tell you he was taking hydroxychloroquine before he announced it?
Thank you.